Hi everyone, welcome back to my channel. So menopause, just as perimenopause, can be a very difficult time for women. Menopause symptoms can have a very big impact on your daily life, on your relationships, your work, social life and family life. It certainly had a big impact on my life. And many women know very little about what to expect from menopause. And I was one of them. I was completely unprepared for what happened. So learning more about menopause and knowing what to expect will help you not just to better deal with the symptoms, but also to accept this new phase of life. That's why I've put together a list of 21 most common signs that you might have entered menopause. The first sign of menopause is usually a change in the normal pattern of your periods. They can become irregular, heavier, lighter, more or less frequent, and in menopause they stop completely. A woman is said to be in menopause when she hasn't had a period for 12 months in a row. Hot flashes. Short, sudden feelings of heat, usually in the face, neck and chest. They are the most common symptom of menopause. About 75% of all women experience them. For 80% of women, hot flashes occur for 2 years or less, but for some, for more than 2 years. Night sweats are the hot flashes that occur at night and often cause women to wake up drenched in sweat. Difficulty sleeping. Many women in menopause find it hard to sleep through the night. Low levels of progesterone can make it hard to fall and stay asleep. Low estrogen levels can also cause night sweats. Many menopausal women get urinary symptoms that make them get up several times during sleep to urinate. All of that may make you feel tired and irritable during the day. Mood swings or irritability. Due to changes in hormone levels, women in menopause can experience unpredictable mood shifts. For instance, they can suddenly feel angry, weepy, or sad. Depression and anxiety. Your risk for depression and anxiety is higher during the time around menopause. This may be caused by changing hormones, menopausal symptoms, or both. Difficulty sleeping will contribute to that. If you have symptoms of depression and anxiety, see your doctor as they may recommend you therapy. Problems with memory, concentration, and brain fog. Lots of women experience brain fog during menopause. They may experience difficulty to think clearly and to concentrate, memory loss, forgetfulness, or difficulty recalling the right words. All that happens as a result of changes in your hormone levels. So rest assured, there are biochemical reasons for your foggy brain. It's doubtful that you have early dementia or are losing your mind, a fear many peri- and menopausal women have. Reduced sex drive. A loss of sex drive is really common. Up to 40 to 50% of women going through perimenopause and menopause experience a loss of sex drive. There are many reasons why it happens. One of them is the loss of estrogen during menopause that affects mood and energy levels, and our libido too. Hot flashes, night sweats and difficulty sleeping, and for some women depression and anxiety, also have a negative effect on our sex drive. Falling estrogen levels result in vaginal dryness and thinning vaginal lining, making sex painful. Among other factors that can contribute to the loss of sex drive can be changes in body image and self-esteem, as well as concerns about aging. Also, worry and need to care for aging or ill parents may also contribute to reduced sex drive. Vaginal dryness and pain causing discomfort during sex. Low levels of estrogen may cause your vaginal tissue to get dry and thinner. This can cause itching, burning, and pain or discomfort. It can also make sex painful and cause tearing and bleeding in your vagina during sex. Urinary urgency or incontinence. Women in menopause may experience urinary urgency, that is frequent and sudden urges to pee, or stress incontinence, when you pee by accident, for example when you are laughing or doing exercise like running or jumping. Urinary tract infections. They are common infections that affect the bladder, the kidneys, and the tubes connected to them. UTIs can be painful and uncomfortable. Changes in skin conditions, including dryness or increase in oiliness and onset of adult acne. Hair loss or thinning. Hair can thin out all over or from the crown or sides. Hair may also become brittle and new hairs finer. Increase in facial hair. Changing hormones can cause some women to have an increase in facial hair. Joint stiffness, aches and pains. Estrogen assists in joint lubrication and decrease inflammation. That's why its loss can result in joint aches, pains and stiffness. Headaches or migraines. Headaches can be triggered by hormone fluctuations as well as lack of sleep, stress and mood changes. Those prone to migraines may suffer longer, more frequent attacks. Heart palpitations. During menopause, it's common to notice heart palpitations or irregular heartbeats that feel like a pounding or fluttering in the chest. This is normal, but it's always worth to talk to your doctor about that. Osteoporosis. Low estrogen can lead to bone density loss. Your bones can become fragile and easier to break. Weight gain is complicated. The reasons for weight gain will be different for every woman. As we get older, our metabolism naturally slows down, and we often lose muscle mass, resulting in fewer calories being burned. As fewer calories are being burned, fat accumulates. Also, menopause symptoms often disturb your sleep, and sleep is essential to regulating our hormones, our mood, or our physical health. You wake up tired, that makes it much harder to exercise and make healthy food choices. The hormonal changes of menopause also tend to make it more likely that you will gain weight around the abdomen rather than the hips and thighs. Feelings of loss of self. You may feel your personality has changed in a short space of time. Emotional and cognitive changes caused by hormones can strain relationships, lower job performance, and challenge our self-image. You might wonder if you'll ever feel like your normal self again, and this can be incredibly frustrating. Loss of self-confidence and self-esteem. There are lots of triggers for loss of self-esteem. First, you are trying to deal with other menopause symptoms like hot flashes, disrupted sleep, aches and pains, and irritability. It's hard to feel like your usual strong, confident self. Second, falling estrogen levels affect adrenal health. The adrenal glands help regulate the body's response to stress and the performance of the nervous system. That may make you feel more stressed and anxious even when it comes to daily activities and things you used to find easy, such as talking in a meeting or driving on a motorway. The important thing to remember is it's not in your imagination. Loss of confidence is a very real symptom of menopause, and it's a very common symptom. A huge 67% of people said their self-confidence plummeted during menopause, according to a recent survey. So please remember that you are not alone in feeling this way. So these are some of the most common menopause symptoms. However, if you have any doubts that your symptoms could be related to an illness, don't hesitate to see a doctor as soon as possible. Do you have or had any of these symptoms? And which one was the worst for you? Please share your experience with us in the comments below. And if you found this video helpful, please give it a thumbs up, as it may help other women to find it. Also, please share it with anyone who might benefit, and don't forget to subscribe so you won't miss any other video. And I will see you next time.